Say yes to new beginnings.
Yes.
Say yes to new standards of excellence.
Yes.
Say yes to engaging reportage with a difference.
Yes.
Introducing Yes International Magazine.
What makes a good medical practitioner?
That's a big question, and probably that would go to the basics. What makes one to want to become a doctor? And these are basic things. You have to be empathic. You have to love others. You have to have a passion for caring for people, and you just have to be dedicated to that profession. When you do all these years, you become a successful doctor.
So anybody who wants to go far in the medical profession, what must the person do?
You must be dedicated to your work. You must think beyond making money. Just make sure that it's a humanity call, a call to serve humanity, a call to care for people, and a call to bring smile and joy to people's faces when they're in pain.
Okay. Now, what is the commonest mistake that any medical practitioner can make?
The commonest mistake, to my mind, is when you think you are only out to make money. But when you aim to bring joy and laughter and smile to people's faces, and when you are passionate about your work, then you are on to being a successful doctor.
Okay. Now, one of the things, that most people can't wrap their head or their heads around is the fact that medical doctors usually come in contact with blood a lot. So how do you cope in such an environment? How does the medical doctor get used to, seeing blood and seeing corpses and stuff? How do you cope with that, sir?
Maybe I'll answer that by casting my mind back to medical school days. I remember that the first time we went to the dissection room, that's anatomy now, and we had two of our students, two of our mates, they are girls, and they saw the corpses. I tell you that they fainted, and that was the end of their career in medicine. So before you go into medicine, you must be somebody who is not afraid of seeing blood or afraid of seeing dead bodies, because you are going to come in contact with this all the days of your life as a medical doctor.
Okay. So as a person now, each time you come in contact with those two things, how do they make you feel?
Well, like I said, it's going to be something that you have to live with all the days of your life. So you get used to it. Blood, yes. I mean, for people who have injuries and all that, blood will come out. Even by getting blood from patients, I mean, it's a part of it, what we call a vein puncture. You have to draw blood in order to do some tests. So you just can't run away from it. And of course, dead bodies, one way or the other, you also come into contact with them. Either they bring dead bodies as a result of accidents, or you are treating a patient and eventually the patient dies. You still have to do the needful. You have to counsel and comfort the relatives of the patient. So you don't have to be afraid to be beside the dead body. Otherwise, your work will not be complete.
Okay.